The times are very good for us in digital health now. We have over 300 million digital mobile phones which can now be used to deliver healthcare services and healthcare information to far parts of the world and especially in India. What I see digital health making an impact is first in accessibility. Information which is available online through digital health can make it available across the country. Consumers can, through their phones and through their laptops, can access information on digital health any part of India. The second thing digital health does is it removes inefficiencies. By having data of healthcare in the form of digital format, it helps in getting it transferred from one location to another location. To give you an example, a consumer who's meeting a doctor and a doctor diagnoses him for a lab result, if the lab results are uploaded online and the consumer is given access to it, he can then be able to, not having to travel again to get the lab report from the laboratory. Apart from that, he can use this lab report and get it checked with multiple doctors if required. So what it does is digital health ensures that inefficiencies in the system get crossed out. And also, one of the important cornerstones of digital health is its ability to improve the consumer experience. When a consumer's experience of health starts improving, it ensures that it improves the need from consumers' side and improves the amount of the demand from their end. What I've seen is when you make things more convenient, the demand increases. And when demand increases, supply is always very happy about it. So if you look at the healthcare market, digital health will improve accessibility. It'll help in removing efficiencies. It'll improve efficiencies. It'll improve the convenience as well and the entire consumer experience. The digital health, if you look at digital health, there are three very important components in digital health. One is to bring in digital health to bring the providers and the healthcare establishments online. The second part of digital health is to bring the consumers who want these services online. The third part of digital health is to bring the data that is between these online. So if you have the consumer, you have the provider, and if you have the data online, if the three are connected through digital mediums, I think that will that will comprise the entire digital health. And this is taking off. All these three elements are taking off in India and outside India. In emerging markets, we have a very new phenomena. Where the entire emerging markets has completely leaped over the computers. So in India, for example, consumers are now accessing digital without having to move to desktops and offline and then moving to online. They're going directly to online. That's a fantastic phenomena that's happening in India and other emerging markets. Emerging markets like Brazil, Indonesia, Philippines. What we are seeing is consumers here are moving directly to internet and are not going through the normal process of going offline first and then online. This helps in ensuring that you do not have a very fragmented systems in place. What usually happens in developed markets is that you have offline systems which are fragmented in nature and they're not connected to each other and they don't talk to each other. But because of the emerging markets moving directly to an online medium, we are having a much more connected healthcare ecosystem, and the data that we are bringing online can be far more connected. So I believe that it's not just in India, but in all emerging markets like Indonesia and all these large emerging markets where there are very large populations, digital health is having a huge impact because people are now moving directly to online, and that's bringing many benefits to consumers, to providers, to the entire healthcare ecosystem. Our vision of Practo is to make sure that we are able to provide consumers with all the data that belongs to them. Their entire health data must be made accessible to them. That's our vision as Practo. For making this vision possible, we have two very important products that are playing in the market right now. One is called Practo Ray. Ray is the most successful SaaS product in India today, which doctors use on a daily basis to manage their patient databases, to manage their patient health records, the prescriptions, the x-rays. All of those are managed on Practo Ray today across India. Now the software is used completely online, and doctors use it on their tablets, they use it on their phones, and it helps in making the data, which was till so far on paper, in digital format. And when the data comes in a digital format, a lot can be done with it. Coming to the next product of ours called Practo.com. Practo.com is a consumer website which allows consumers to find doctors and book appointments. We have over 200,000 doctors on our platform today. And you'll be very happy to know that there are about 10 million searches happening on our platform right now. So 10 million consumers, their accessibility issue is being solved by Practo.com, where they are able to find a doctor, a provider near their area using Practo.com. And Practo.com helps them find the relevant doctor based on their choice and then get an appointment with them. So this is how both the products of Practo are evolving, and in both the products we have a very significant market share in the industry, and we're working to make sure that both these products work with each other to make the entire consumer experience, right from finding a doctor to booking an appointment to meeting the doctor and having his health records managed, and the follow-up is completely in a digital medium, and it's a fantastic experience for the consumer. End of the day, the consumer experience, if you provide a 10x better consumer experience, you can you're basically doing a big service to healthcare. I think it's a great question. What we have seen is that almost 30% of our traffic on our website comes from Tier 2, Tier 3 cities, which is very surprising to us because we have not even ventured there so far. What our belief is that our product is completely based on the internet. Today we have expanded to 35 cities and we will expand going forward into more cities. And we believe that internet is also spreading at a very fast pace to Tier 2, Tier 3 and beyond. So we will move with this penetration of internet, and with the penetration of internet we will take our services there and serve the nation as a whole. I think that internet is spreading at a very fast pace. India today has 300 million internet users. Probably in a few years, in 3 years, it'll have 700 million internet users, and most of them will be outside the tier cities. And using internet as a backbone, we will channelize our services and goods through that medium. There are multiple challenges in healthcare. The first one is trying to ensure that there is a common standardization. When we have multiple providers, healthcare is quite a complex sector, where you have on one side you have the consumers, but on the supply side you have hospitals, you have doctors, you have diagnostic centers, you have pharmacies, you have drugs, you have medical devices, you have so many different industries that have to work with each other. And for them to adequately work with each other, if they are able to talk with each other in a very particular manner, then we can leverage the industry to a much more larger degree. So if the pharmacy can talk to a diagnostic center, if the diagnostic center can talk to a hospital, if a hospital can talk to a med devices, if devices can talk to each other, I think that'll add a lot of it'll make the whole ecosystem much better connected. And we believe that that's one challenge that we face. That's very difficult to talk to different parts of the ecosystem. The second part that we think healthcare is a little difficult is probably the role of policy. The role of policy is very important in healthcare. We have seen countries where with very strong policy support, adoption of digital health has taken reached new heights. For example, on an average, we have seen that countries do not have any incentivization to providers. We have seen an digital adoption of EMR to a degree of 25%. But in countries like Australia, countries like Singapore, countries like US, countries like Denmark, where there is an incentivization to the provider to digitalize the records, we have seen a 3x increase in the percentage of health records that are getting digitalized by providers. Why that helps is if you have your EMR records digitalized, it again, that data is extremely valuable, and that helps, making the whole system far more efficient. So these are the two things I think, are challenges that I'm sure going forward, the industries will work together to solve them. And once they get solved, and once there are improvements made in these two, I think the whole digital health movement will move stronger and faster. I think it's only getting started, and it's very exciting. It is a very exciting time for us entrepreneurs in the healthcare sector. On one end, you have the number of internet users increasing at a very fast pace in India. On the other end, you have providers, you have doctors, you have hospitals who are recognizing the role digital health can play in improving the overall outcome, experience, accessibility, delivery of healthcare. And it's an undeniable fact now. So they are also very excited to adopting more, and the change is going to be much more faster. I started this company 7 years back, and it's taken me a pretty long time to make the impact that we have made. But going forward, I think with each year, I think that there's going to be exponential impact that digital health will have in India, both on consumers, to the industry, and to the nation as a whole.